and patient empowerment. Welcome everyone to our webinar today, Symptom Management and Patient Empowerment through the Long COVID Wearable Studies. My name is Tim Xiao. I'm the Chief Scientific Officer for Solve. Today, we're excited to welcome Dr. Julia Moore Vogel, Senior Program Director at Scripps Research. So Julia actually had a lived experience with Long COVID and ME, and she is also a co-principal investigator for the participant center of the All of Us research program. She received her PhD in computational biology and medicine and MBA, both from Cornell. Without further delay, so thank you so much for joining us, Julia. Please tell us more about your current clinical trial and explain to our audience how they can get involved in this study.
Absolutely. All right, you can see the slides okay? Yes? Okay, great. Okay, thanks, Tim. Thanks, Solve, for having me. I'm really excited to share the study with you today and more importantly, hear from you and answer all your questions that you may have. So what we're going to do here is do an overview of Long COVID as well as information about ME, an introduction of our study, the Long COVID Wearable Study, and we'll spend most of our time really on Q&A. So what is Long COVID? I know most people on the seminar probably already know, but just to make sure we're starting on the same page, it is a patient-created term that broadly defines signs, symptoms, and conditions that continue or develop after a COVID-19 infection. Generally, we say it's present for 4 weeks or more after the infection, and it can present as a combination of over 200 symptoms. So it can look very different from one person to the next. One important note, especially these days when testing is less common, is that people may not have documented or even realized that they had COVID before they developed Long COVID. This is one piece building on the 200 symptoms that Long COVID is multisystemic. This is a paper from the Patient-Led Research Collaborative, some of the first work really documenting what Long COVID is. And this is a demonstration of the over 200 symptoms and the many different body systems that it can affect. And I actually couldn't even fit them all on one slide. It doesn't include the neuropsychiatric symptoms as well. So it's a very multisystemic disorder. We actually know a lot about Long COVID, in part because of its being built on decades of work from the infection-associated chronic illness and conditions community, including ME researchers for sure. There are at least 76 million cases worldwide as of August 2023, and we've actually seen in the US increasing cases in recent months, so that's likely an underestimate. A lot of people with Long COVID also have ME/CFS and or POTS, as well as a lot of different co-occurring conditions. About half have ME and half have POTS. About 75 to 90% of Long COVID cases happen following a mild and acute infection. So although you are more likely to get Long COVID if you're hospitalized because a smaller number of people are hospitalized, there's actually more people in the Long COVID community that had a mild and acute infection. And of course, there are no broadly effective treatments, which is surprising, although there is hope this year, which we can talk about more in the clinical trial section, or sorry, more in the Q&A section. So who has Long COVID? This is data from the latest CDC household pulse data. It's showing that over 6% of people in the US in general have Long COVID. And you can see the different trends here across cisgender males being the lowest, then cisgender females, and then the transgender population having the highest rates of Long COVID. You can see different rates across different races and ethnicities, with Hispanic, Latino, and multiracial individuals having the highest rates of Long COVID. And it's really impacting the disability community much more than the individuals who did not have a pre-existing disability. This next slide is very similar, but it also includes how much Long COVID limits daily activity. And so the light blue bar is the same as what we had on the previous slide. The middle blue is individuals that have Long COVID that limits activity. And then the darkest blue is Long COVID with significant activity limitations. And so you can see, especially in the transgender community and the disability community, there's a really disproportionate amount of those highest impact cases where Long COVID is very significantly limiting activity. So there's a lot of diversity in how Long COVID is affecting different populations. The next piece that we wanted to zoom in on is the fatigue component of Long COVID and ME. And so this is sort of my way of thinking about fatigue from my lived experience that I'm welcome for people to say and share their different experiences. There's sort of the time scale that I was used to pre getting long COVID, where minutes after exertion, you're getting tired. Like, you're jogging and your legs are getting tired the more you jog. One of the things that was very counterintuitive for me and many others to experience is the concept of post-exertional malaise. So this is really, 24 to 48 hours, for some people less, for some people more, but most people it's in that range of worsening of symptoms following exertion. And so this is really crucial to limit. You don't want to be getting post-exertional malaise because it can worsen your condition over time. And over here at the right is some information from the Patient-Led Research Collaborative's initial characterization of long COVID that showed when people had post-exertional malaise starting. So the most common following physical exertion is the following day. And then it's a little bit different for mental exertion, which is interesting. The other time scale of fatigue I wanted to talk about is weeks to months after having a lower activity level, you can end up with deconditioning. And so there's a lot of debate about how to address deconditioning and when deconditioning arises. To me, it's a much longer time scale than post-exertional malaise, although some people confuse them. This can be a concern as well in post-ICU patients. If you were immobile for a really significant amount of time, then that's where deconditioning can come into play. But for the majority who had relatively mild cases, the deconditioning is really starting as part of long COVID and not part of acute COVID. So that brings us to pacing, which is what the Long COVID Wearable Study is all about. So pacing has been used by the ME community and many other illnesses to manage symptoms for quite some time. It's the concept of trying to stay within your energy envelope or within your energy limitation so that you avoid post-exertional malaise. Again, in the same paper by the Patient-Led Research Collaborative, pacing was the most important or the most helpful treatment that anyone had tried, at least at that point in 2020 and 2021. But it's actually really hard to implement. I tell people it's sort of like eating healthy. Like everybody knows about the food pyramid and that you're supposed to eat healthy, but it's actually very hard to do. Pacing is similar, except it's like you don't get to have the dessert of life because you're not, able to expend the energy that you need to be able to reach that fun thing that you want to do. But it can be very helpful for reducing symptom burden and trying not to sort of spiral into worsening the condition overall. We know that pacing is not going to solve the root cause of our illness, and I want to be, straightforward about that. There's a lot of physiological things happening, and pacing is just a way to try to reduce the impact of the illness on our lives and reduce the severity of symptoms. So getting to the Long COVID Wearable Study that we're here to talk about, what we aim to do is really rigorously validate the patient community's experience. I was taught by other patients about using wearables to pace. I believe it came from the ME community, but I can't know that 100% for sure. So what we're doing is having a fully remote study that will use wearable devices to help people with long COVID, ME, and POTS better manage their symptoms. That's the goal. So folks can either use their own device that they already have. If you have an activity tracker or a smartwatch or a polar band, whatever you have that you're willing to share data from, you can share that information. Or if you don't already have a device, we're distributing Garmin devices that have this body battery feature to eligible folks. So what we're doing is having people complete surveys and share data for a year. We've tried to be very conscious about how many spoons the surveys take, which we'll talk about a little bit more. We started with, myself as someone with lived experience, creating the study along with input from others with lived experience. And then when we were almost ready to finalize things, we recruited 11 different individuals with long COVID to try it out, basically end to end, receiving the device, doing all the surveys and telling us what they thought. We conducted interviews with them to learn about their experience and incorporated what they advised us to do into the study materials. It was really interesting that 89% reported that the information was helpful for their symptom management. That's not necessarily going to scale across a broader group, but it was really exciting to see. And of those who experienced a relapse or post-exertional malaise or crash, whatever you want to call it, during the testing time period, 86% said that the study information and device helped them reduce the severity or duration of their crash. And so that's also really promising in terms of what the study can do. There is also a really nice quote here from Estella, one of our user testers, just talking about how the condition is so challenging because you don't know what to expect, but having this information and device can help empower you to have more control over things. Of course, we're never going to have complete control, but we'll take any control we can get, right? So we wanted to review the inclusion criteria. Individuals need to be at least 18 years old and reside in the United States. And I know we would love to have this be global, but there are a lot of different regulatory burdens that come into play that we're just not able to manage on the limited budget that we have for the study at this time. You can have a self-diagnosis or a physician diagnosis of long COVID, ME, and/or POTS. You need to be interested in tools to manage symptoms, either own a wearable device that you're willing to share data from for the study, or not own a device and agree to use one that we provide you. Agree to wear the device throughout the study period and make sure you're sharing your data at least weekly. You need to have access to a device that enables syncing the wearable data and viewing feedback. Agree to disclose your involvement in other interventions. So that's just in case you have some other treatment that that really changes things for you, that we know about that, so that we can factor it into the analysis that we do. And then we're asking folks to agree to complete at least 75% of the surveys. We're not aiming for 100% because we know everybody's going to have days that they can't do the surveys, even though we've tried to keep them as short as we can. But we do want to be able to have a really clear picture of what's happening with each individual throughout the year of their participation. So we're almost done with my slides and ready to discuss. What is the reason to consider joining? You can help researchers understand how different people experience long COVID, receive information designed by long COVID patients and researchers to help you manage your symptoms, and learn about how your lifestyles, action, and environment can affect your symptoms and potentially discover ways to manage them. So we have educational materials with this sort of information in the as part of the study that we distribute, and we really point to a lot of the best-in-class resources that are out there that a lot of different organizations have put together, so that you have a collated resource to go to try to help you learn how to implement this technique. So if you'd like to join, there's a lot of information about the study on the website that's sort of general introductory information. If you're ready to see if you're eligible, you can go to this second link, which has the eligibility survey. And then we also wanted to point out, if you're already a Solve Together participant, you can use the same login credentials for both studies. So they're both run on the Care Evolution My Data Helps platform. And so you can use one account and be able to log into the platform together. We also really would love help spreading the word, especially to people who otherwise would not have access to a device. You know, we're particularly interested in getting the devices in the hands of people who really couldn't afford to buy them on their own, knowing that a lot of people with these conditions face a lot of challenges with income and housing and that sort of thing. For any questions, you can reach out to the study team at this email address anytime, but of course we will work to answer your questions today as well. And I wanted to end with a lot of thank yous, especially to the Long COVID and ME community, in particular our 11 user testers, the folks in the Long COVID Body Politics support group who taught me how to use Garmin to pace. We don't, share the discussions from those groups, so I won't shout out anyone individually, but if they happen to be on here, I'm endlessly grateful to them. All the organizations that created pacing materials that we link to in our educational materials given through the study, a lot of colleagues at the Patient-Led Research Collaborative who gave really early input on the study design. And of course, we want to thank our study participants. The next group I want to thank is my Scripps colleagues who are named here, who really helped bring the study to life. Solve for hosting, of course. We have some funding from an anonymous philanthropist, as well as early concepting of the study was done through the All of Us research program. And then, of course, our partners, Scripps, Garmin, and Care Evolution have also been absolutely instrumental in making the study happen. So with that, I'm ready to discuss. Tim, do you want to help me? Thank you.
Thank you very much, Dr. Vogel, for your presentation. I think this is a great presentation, and then one thing I do want to ask for the audience, which you already mentioned in your slide, is that although the name of the study is called Long COVID Study, but actually you recruited more than just people with long COVID condition. Can you reaffirm the audience again what other condition can be eligible for the study?
Absolutely. Yeah. So we call it the Long COVID Wearable Study because that's sort of where it was rooted in, the beginning. But we recognize how the study wouldn't even be happening without the ME community really validating the need for pacing and how pacing can be used to manage different conditions. And we think it's really important in studies of long COVID in general to have comparator groups of folks with ME from other sources other than COVID and POTS from other sources. And so I think of it as really an infection-associated chronic condition study in general. It's like, long COVID, we expect to be the large majority of participants, but we really want that umbrella to be broad, and we plan to do subgroup analyses across. I know there's a lot of debate about how much similarity there is. For me, I have been diagnosed with ME. From what I read about people with ME from other illnesses, it seems exactly the same. Of course, the pathogen is different, but we know that people can already get ME from a lot of different pathogens. So to me, it makes perfect sense and should be a priority to include infection-associated chronic illnesses broadly in our studies of long COVID, even though, long COVID is the most prevalent. We can really expand out to be applicable to other conditions and learn more, not only for those that have been sick for decades, but also for the next pandemic, right? We need to know, is this applicable across all pathogens, or is it COVID specific? So that was a little bit of a long-winded answer, but I think it's really crucial to include the community more broadly.
Yeah, thank you very much. And you also mentioned that Solve Together participants can join. So I want to kind of have a side note here. So if you already have the app, which is My Data Helps, you can pretty much use the same app to join this long COVID study that Dr. Vogel is leading. Is that right, Dr. Vogel?
Yes, absolutely. Sorry, I'm reading the questions while you were talking, but yes, you can join with both. If you already have the study app, you can join as well. I'm trying to think about exactly how it works with the eligibility study. I'm pretty sure what you do is you go to the eligibility questionnaire that I linked here. And then when it's time, when you are eligible and you can log in to your account or create an account, you just log in using your self-credentials, and then it should show up in your app. So it's a little bit confusing, but just know that the login credentials are the same, but you still have to go through the eligibility survey.
Yeah, thank you, Dr. Vogel. And the question comes from the audience is about the gaps. So sometimes our user may forget to charge or put the wearable back on. So how should they handle the gaps?
Yeah, I mean, I think of it similar to the survey data that if you can wear it 75% of the time, that's great. They all have to charge, and we all, sometimes forget to put it back on. Of course, brain fog's not doing us any favors. But I think 75% of the time to wear it is a good goal. The models are waterproof, and so, to me, bathing is one of the most important sources of exertion. So I always want to make sure I can wear it at that time, because that's a big drain on your energy stores. So yes, you can wear it as much as you can, but you don't have to strive for perfection.
Yeah, thank you. So I think this at least partially answered one question from the real-time audience about whether it's okay to take the wearable off at night.
Yeah, I mean, I'll just say, in terms of taking it off at night, it's okay for I think you get really valuable data yourself from the device by wearing it overnight, because it takes into account the quality of your sleep and the duration of your sleep. And so a lot of times, I'll wake up feeling like I really didn't sleep well. And I didn't talk too much about the body battery feature, but that's really the reason that we chose Garmin, is because they have this body battery metric that takes into account what you do each day in terms of your heart rate, your step count, your sleep, your heart rate variability, and it puts it into this number 0 to 100 that changes throughout the day. And that's what's really different from the other competitors, that in our analysis anyway, that you really get to see how much your battery is draining. Like, let's see what mine is. Mine is 50 right now. So my goal is always to stay above 50 until at least noon. So I achieved my goal today, which is awesome. But this is going to drain me, right? And so I know from previous experience that doing a webinar means I need to rest after. And I would really see that in my battery, how much it goes down throughout this hour. And, having the sleep data in there helps you be set up for the day and know, where your energy levels are based on how restful your sleep was the previous night. So it's fine to take it off, but I recommend wearing it for your own data.
Thank you. That's very helpful. And we also have a question about the data accuracy that's collected, about the data collected by the wearables. So I think there's a reason that the study you have chosen a certain wearable to use. Could you help answer how your team will manage any data variance or inaccuracy that might be embodied in the wearable collection method that might be used?
Yeah, we know that they're not perfect. Basically, the farther you get away from the heart, the lower quality your reading is going to be. So since it's on your wrist, it's a little bit far, as well as it depends on how you wear it. The less daylight there is between your arm and the sensor, the more accurate it's going to be. But that can be uncomfortable. Some people get self-limiting rashes if it's too tight. So, you have to sort of balance things. For us, we're really thinking about individual sort of baselines and variations. And so it matters a little bit less what the absolute number is. Of course, for yourself and your own healthcare and your own heart rate monitoring, it may matter to you more. And you might want to use like a polar chest strap is going to be more accurate than a wrist-worn device. But we find that the wrist-worn devices are easier for people to wear long-term and sufficient for what we're trying to do, which is guide your own personal baseline and your own personal choices rather than setting broad thresholds based on specific metrics. Does that make sense?
I hope it makes sense to the audience. So thank you for explaining. And actually, related to that, there are a lot of questions about the wearable, the choice of wearables.
Sure.
Could you talk about, there's several questions regarding that? Do you pick the Apple system? Do you pick the Google system, Samsung? And whether the Fitbit charge heart rate work for syncing with the users? Would you share some of your insight with our audience?
Sure. So we did sort of a landscape analysis for what device we wanted to distribute for the study and ended up with Garmin because of the body battery feature and, the general long COVID and ME community's success with the Garmin. But for folks who already have other devices, we can accept data from many different sources as long as you can share it from Apple Health or Google Fit. Depending on which sort of smartphone you have, the data can get to us in our system. We also have direct integrations with Garmin and Fitbit, which allow for getting more of the metadata than Apple or Google Fit would share. So all of those are, all of the devices that you mentioned are devices that can be shared through our platform. And I guess I just want to say, if there's one that you can't figure out how to share, you can reach out to the team and we can help you. And it's very rare that we wouldn't be able to collect data from it.
Thank you. And does the study actually teach the user how to pace?
So it provides educational materials for you to use. So that's what I mean by teaching, that you review the materials and you think about it, how it applies to you. It provides sort of general guidance. I'll say if you have one of the study provided wearables from Garmin, Garmin also has really nice data inside the app. I'm wondering if I should just show what my app is saying right now, but it'll say things like, oh, your battery is a little bit low for this time of the day. You should probably rest. So there's that sort of guidance as well. Or it'll say, you're doing great. You have a lot of energy for the day. You could take on a little bit more. That's not usually accurate for me. Usually I feel like I can never take on as much as I want to, but there is that sort of guidance also that really is individualized based on what the device has seen for you, what is normal for you for that time of the day, and what you normally do.
Thank you. And there are some questions asking for the details regarding what data that your team plan to use from the device. So I think especially a question about what will be used for the analysis of the study.
Yes. So for the primary endpoints, they're really about quality of life And so the quarterly surveys are going to be the main endpoints about whether the intervention of providing the device made a difference for symptom management. So I'll just explain a little bit more about the study design, which is that if you're getting a study provided wearable, you either get it at 0 months when you first enroll, or you get it at 3 months. And so we'll be comparing people at that 3-month time point for those who got the device initially and those who didn't have the device for those 3 months, and seeing what changed over time between those two groups. Then we'll do a within individual comparison as well for those that got the device later. How did they vary from their first 3 months to the time after they had the wearable in terms of quality of life. The data from the device is more to be used for exploratory aims. One thing I would really like to be able to do is help people identify what their thresholds are. Like, you should not go over X heart rate or X step count if you want to avoid post-exertional malaise. And so that's where having the feedback we have weekly surveys as well, which are about 1 minute long, just saying, did you have a crash this week? How bad was your pain? That sort of thing. That I'm hoping to be able to use together with the wearable data to create more personalized guidance that's really more specific to the illness that we have. But that is more challenging, more of a stretch goal, I guess I'll say, because I'm not sure how well we'll be able to do with that, but that's really the key for the wearable device itself.
Thank you. And the question about people who have signed up through the study through their Solve Together account. I believe that they can express an interest, but then there will still be a screening process on your end. Is that right, Dr. Vogel? Can you explain a little bit more how each phase of that recruitment will go?
Yes, there's still you just go through the eligibility survey. And then if you're in the study provided device cohort, there's a manual screening of your eligibility information, as well as a manual assignment of the code that allows you to get that device. So there's a little bit of a delay for that part, but otherwise it's automated on the app. And if you meet the criteria, you go forward.
Thank you. We also have participants saying that experience of the condition is quite variable, and when it comes to physical as well as mental fatigue and PM. So how do you use a wearable to limit physical as well as mental activity?
Yeah, so this is something I'm really interested in because I also I shouldn't put it on this person that's asking the question. I individually underestimated how fatiguing mental exertion can be. So this is something I'm interested in exploring. How well is this tracked, right? Does your heart rate increase when you're mentally fatiguing yourself? Certainly if you're doing some public speaking, it does, but if you're just reading the newspaper, maybe if it's something stressful, it will, but there could be ways of fatiguing that might not be captured well on the wearable. And I'm also very aware of, the severe and very severe population is not going to have a lot of physical movement that's going to be tracked on the app, right? And so I'm really interested in how well this works for that population, because at least, the sleep quality tracking can be part of it. We can explore how much heart rate variability is, helping understand crashes and predict crashes. But this is really an open area, in my view, in terms of how much wearables can do to help with that sort of exertion. I will say, for my N of 1 experience, the body battery just gets me. And when I am mentally tired, it is reflected in the numbers. And I don't know how they do it, but I think it's a great tool, and I'm really interested to see how that scales to this broader study population.
Thank you. And we have another question from a user who has already been enrolled into the My Data Helps, and who is also using the Visible Plus. So I just want to explain that the question is whether should he need to enroll to this study at Scripps as well. So I think my understanding is that this study is under a separate IRB approval protocol, as well as consent form. So to facilitate a more systematic investigation, but done by the Scripps team, you do need to separately be enrolled into the study. So Dr. Vogel, would you want to add more detail to this?
Yes, they're separate studies. I am involved in the visible reinfections study as well through PLRC. I don't know that there's a way to share your visible data. I don't think the platforms know how to talk to each other, but I could talk to the visible team and see if there's any way to get that data sharing going. That would be a stretch goal for the future. In terms of, I know that Visible is also working to provide pacing guidance and have an algorithm. So I think we're thinking in similar directions, and we know each other, and I champion their efforts as well and cheer them on, but we're doing kind of independent work in terms of creating the analyses for how we would do that.
Thank you. And the question asked about whether the study is recruiting healthy controls. If so, what is the enrollment criteria?
We're not recruiting healthy controls for this one, just because resources are so limited. I really wanted to focus on the population and have the controls be, those with the illness that got the device later. But it's definitely something that we're thinking about for the future. And, we recognize that the data is going to be very different in healthy controls, of course.
Yeah, thank you. And a question more specific about a device called Whoop, which I'm not familiar with. This device can be, accordingly, can be integrated with the Apple Health. So can this device be used in this study too?
Yes, as long as it goes to Apple Health, it can be included. I actually haven't used Whoop myself, but I know that a lot of people really, really like it and find that it's helpful for ME and long COVID symptom management.
Yeah, thank you. And for a participant, do they need to proactively log into the app weekly, or will there be automatic notification or email reminders?
There will be notifications weekly to remind you. So you can decide if you want email notifications or push notifications on the app, and we'll remind you weekly. And we send follow-ups because we totally understand that, you might not be able to get to it at the time that we send it, and then it might evaporate from your mind. And so it's the weekly, really 1-minute surveys, and then the quarterly, more extensive quality of life assessments will remind you about both.
Yeah, thank you. And we have also a question that's more specific about the someone who's using My Data Helps, and this person has an issue with a notification on heart rate. So it seems that the issue there might be some communication issue between the wearable and the phone. I wonder, in this case, whether you have seen or experienced any communication issue, any tips can share with any back regarding how to make sure each device the phone and device are communicated well throughout the day where the user wants the data to be tracked.
I don't. I'm just trying to read the comment now. I don't know too much about the My Data Helps notifications. I would say you should be able to write to the team there about that specific algorithm and what they use. It may be that the data only comes from Apple to the My Data Helps platform once an hour or something like that. But I'm not too sure about what the tech is that would be causing that delay.
Yeah, thank you. I think that's something if you are a Solve-Together user, please send us the email. We can try to work with Carevolution to try to find an answer for you. And another question that came in is about, it's more scientific. Is there any evidence that individuals with ME/CFS or other infection-associated chronic illnesses are more prone to have an exacerbation or develop long COVID after acute COVID compared to the population without previous ME/CFS?
Sorry, I was copying the link. Is there evidence that people with ME are more likely to develop long COVID? Is that what you said?
Yeah, I think that's the gist of it.
Yeah, I would go back to the general rates of folks with and without disability. And so, to me, the fact that people with disabilities are more than twice as likely to develop long COVID, I would put folks with ME in that category. There's also a lot of concern in the long COVID community about reinfections, and a lot of folks have seen their long COVID symptoms worsen. And, it happens with ME as well, with any illness. So yeah, I would say that that people with ME are more likely to get long COVID, unfortunately.
Thank you. And so we have a part of the audience asking about the data, the battery data you spoke of. So aside from Garmin, are you aware of any other wearable that provides similar features?
I'm aware of both Aura and Fitbit will do readiness scores. I think Whoop might do this as well. I'm not 100% sure though, where at the beginning of the day, they give you a value that says where you are. And actually, of course, Visible does this too, based on your heart rate variability from the smartphone camera reading. So I'm aware of a lot of folks that do once a day scores. What's different about the Garmin is that it's throughout the day, factoring in your ongoing data about the day. And so that's why we chose Garmin over the others. I also saw a question about could we post about the device selection. We are working on writing that up into a manuscript so that we can share it publicly. But I summarized it pretty much that it's really the body battery is the biggest difference between the others. And one of the things that's really interesting about it is it's made for people to be training, like training for a marathon or something, and make sure they're not overtraining by doing too much and exerting themselves too much. And for us, it's just general life is exerting us that much, and it just so happens that we're able to co-opt this this mechanism. And I saw another comment about, the Fitbit comments aren't really geared for this illness. And I totally agree. There's things like it's celebrating you reaching your step count goal. And for me, I set my step count goal as the threshold I don't want to go over. So I should have the opposite of a celebration. And so, there are those things that are sort of built into this technology because that's what it was meant for. I would love one day for us to have, a more disability oriented wearable experience. And that's certainly what the team at Visible is working to do. And I hope that there's more of that in the future. Right now, we're really just trying to co-opt what's there and do the best we can with what's already on the market. And then one last thing I'll say about what I think is great about this specific type of wearable is they're pretty inexpensive in terms of healthcare interventions. And so my dream for the study would be if we are able to, validate what the community has seen and write it up as a really well done randomized controlled trial, that then physicians would be seeing this and suggesting it to their patients with long COVID and ME and other energy limiting conditions, so that the word is getting out to people that aren't super tuned in to the community and the research the way everyone on this call is, right? I just hope that it can be, hopefully one day even covered by insurance so that people can have this tool on their wrist to really validate what they're going through and also hopefully help them be proactive about their symptoms. I'll say one more thing about body battery since we have time, and that's that for me, the body battery helps me get ahead of post-exertional malaise. So in the moment that I'm overdoing it, my battery is going lower than I would have expected. And it helps me identify that time that I need to rest to try to avoid it rather than most of my indications are delayed. Those, for me, it's usually 48 hours after I've already overdone it. And so having that information in real time is what allows me to make the decision to lower my exertion and avoid post-exertional malaise. Or of course, there are times that you can't lower your exertion. You're sick or whatever it is. And, at least I'm aware and I can still try to pre-rest as much as possible before that crash comes.
Yeah, thank you. And a question that is about actually joining as someone who already joined the All of Us study. So this person is using Fitbit on All of Us. How does this person transition to the study? I believe this person needs to sign up, but Dr. Vogel, would you comment on that?
Yeah, they're separate sign-up processes, similar to the Visible study, where it's a separate consent form. We were just talking about how much we can share data between studies so that you don't have to, share the exact same information again and again. But we'll be working on that in the future. But for now, you basically sign up from scratch in a different consent form and a different data sharing process.
Yeah, and have a question for nod is saying that this printer doesn't have a smartphone. So does the Garmin app work for on the Apple laptop?
I don't know if they work on laptops. If you write to our email address, we will look into that for you. I know Fitbit recently discontinued being able to work with laptops, but I can't remember for Garmin, so we'll have to follow up.
Right. Thank you. And the question asking about the whether wearable will be available through the survey or is there a specific Garmin wearable? I believe this was partially answered, but Dr. Vogel, would you emphasize that point again? You have a Garmin device that you can give away to eligible individuals?
Yes. So folks that don't already have devices and meet the eligibility criteria, we have 3 different devices that are available, sort of different form factors. The one I have is the Vivo Active, I think it's called. That's a very minimal activity tracker because I don't like, all the notifications and everything. I just want the bare minimum information. There's one that's more like a smartwatch, sort of like an Apple Watch comparator. And then one, I believe that's more of a traditional watch. That's the circular watch face. So there's 3 different options that folks can choose from. All are no cost to participants. And there's a few different color options. I have the most boring black one, but usually there's some other options as well.
And your understanding of the landscape of the wearables really got our audience intrigued. So do you happen to have any posts or articles that you summarize your findings about the different wearables?
We're writing it up now. It's interesting because we didn't know it would be of interest to other people as it is, but we're writing it up and we'll make sure to share it publicly when it's ready.
Yeah, thank you. So another question about the educational material associated with this study about pacing. Is it only written or is you have delivered in a video format and other format? There
are some videos that we link to. There's one that's really excellent from Long COVID Physio about pacing. I'm hesitant to try to look up the link right now, but I helped consult with them on it and I was so impressed by what they came up with. And I actually pretty much sent it to everyone I know at the time that it came out because I was like, okay, now you all can understand what I'm going through and why I'm saying I can't do X, Y, and Z. So that is a really excellent video. And we try to link to they also have a written version and they have a audio only version as well, which is nice for accessibility. A lot of the materials are written, but there's actually, I think there's one other video as well that's a panel of experts talking about wearables, but most of the materials are written.
Thank you. And questions come in for Fitbit users and with a desire to switch to Garmin to see whether it actually works better. So I'm not totally familiar with the detailed eligibility criteria for people who can get a study provided Garmin. Could you provide a more detailed view on that?
Yeah, I mean, so if you already have a Fitbit, then we wouldn't provide a Garmin. But part of what we're interested in is comparing folks side by side, right? It's my theory that people with Garmin's are going to get the most benefit from the device, but we need to validate that. So that's why we're going to be still giving the pacing educational materials to people with any device. Again, some will get it right away, some will get it after 3 months, and we'll validate that assumption and see, whether maybe folks with Fitbits are pacing just fine. And really, I actually wear a Fitbit on my other wrist because the Fitbit sleep tracking is really good for me. Whereas the Garmin sleep tracking tends to overestimate how much sleep I get. So I get value from both. And it'll be really interesting to see what other folks do. If you are, a sort of quantified selfer and you have multiple devices, we encourage you to share both because we are interested in understanding the accuracy between both and the perceived value between both. So I guess I can't deter you from buying a Garmin because I think it's very useful, but for the limited number that we have for the study, we're only giving them out to folks that don't already have a device.
Thank you. And I'll have a request for your comments on Fitbit charge HR. What would be your view on that? Would you advise against it or for it? So would hear
Yeah, I
your
mean,
thoughts.
I think it's great for tracking sleep and step count. And so, and heart rate. So for some people, that's sufficient. And especially if you're willing to do sort of your own mental math to put those things together and think about your own energy envelopes and thresholds. Yeah, so I think it's fine. It's a totally fine wearable. I don't think there's anything wrong with it. But it's just that for me, if I'm going to choose from first principles, the one that is the most helpful for folks with limited energy, it's not my first choice, but it's fine.
Thank you. And we have a question asking about the turnaround time. So if a part of the audience filled up the eligibility survey, how much time should I expect before they can receive a response about a decision for enrollment?
Yeah, it should be a few business days. It is a manual process and we have a relatively small team, but I would expect you to hear within a week, certainly. If you don't hear within a week, you could email.
Thank you. And I think another question is about some complication from someone who has both ME and long-term TBI history. So will this be helpful for this individual? And about this kind of overlapping issue, how would the study team address that?
I'm assuming TBI is traumatic brain injury, so the person can correct me if it's
what I
not, but
assume as well.
okay, great. And so, yeah, I think it is really helpful. You know, in my personal experience with physical therapy, my physical therapist used traumatic brain injury informed techniques to help me with pacing. And so this is an area that I think is extremely interesting, the overlap in both management techniques and, you know, who knows what kind of physiological overlap there might be. So I would absolutely think it would be worth trying.
Thank you. And a question about the implication for joining the studies. Will the inclusion in this study prolong any medical leave or provide the extension of any government support, since ME does have official treatment for disease cures, doesn't have official treatment of disease cures?
No, it shouldn't affect anything else. Nothing that I am aware of. I can't imagine that. But I agree that, yeah, we need more treatments and cures for sure.
Yeah. And so could you explain a little bit more about what body battery is?
Yeah, absolutely. So it's this Garmin specific algorithm, takes into account your sleep, your heart rate variability, and step count. And it puts it into this score between 0 and 100. It's sort of meant to be analogous to a cell phone battery that says how much energy you have at that moment in the day. So the beauty of it is that it's changing over time. Like, let's do a check on mine. Okay, I'm at 46. I was at 50, 15 minutes ago. So, it has monitored that my heart rate is high, even though I'm sitting here. I guess I'm moving my hands a lot, but that this, I'm draining my battery in real time. That's the beauty of it, that it really helps you throughout the day decide what decisions to make. And so what I hope that people do, and what I found valuable, is setting different thresholds in my mind that I don't want to go below, whether it's, I mentioned I try not to go below 50 before noon. By the end of the day, I try not to go below 25. And so it's really very personal what your exact numbers are going to be. But the idea is to use that real-time feedback on what's happening physiologically with your exertion to make decisions about how much more you exert yourself that day, when you need to take breaks, but to just help you be able to have data to validate your pacing strategies.
Thank you. And we have questions about, I think there might be some confusion for solved together in the studies. I think the thing is that if you're already a solved together user, it's a different study compared to the Scripps studies. And the Scripps study, because it has its own protocols, you have to start to monitor your activity with a predefined starting point. And also Dr. Vogel's team is going to track the data for the whole cohort systematically. So that would be my view on that. Dr. Vogel, would you have anything else to add to help clarify? And one thing I want to add is that if you are already a solved together user, it's much easier for you to actually participate in a Scripps study, because you can keep on using your same app, you can use your same account, and you can even easily find the link on our platform soon to be able to directly sign yourself up for the initial screening.
Yep, that's right. And we use the same tech platform, the Solve Together platform in the Long COVID Wearable Study. So hopefully the sort of user interface and everything is very familiar between the two. But yes, because of the regulatory aspects of conducting this type of work, they are separate and they require a separate consent process where you review all the risks and agree to take part if you choose to. So that's why they're a little bit separate, but the tech platform behind it is the same.
Yeah, thank you. And also the question about joining the study, that it looks like they need to report the symptom for 3 months before receiving the wearable. Is that correct?
So if you are randomized into the group that has a 3-month delay, then yes. So it's basically for those that are getting a wearable, half will be invited to order it right away, and half will get it 3 months later. And we thought it was really important to make sure that everybody had a wearable. So that's why that's how we constructed our control population. In some control populations, you never get the intervention. So we wanted to make sure that everyone got it and designed it that way for that purpose. But we recognize that the wait is not ideal. It's just something that we need to be able to compare a population where really the only difference between the two of them is whether they got the wearable right away or they got it later.
And thank you. I think a couple other questions. One thing is about what should your heart rate variability be to avoid crashes? And in my impression, this is part of the thing that the study is trying to figure out. Is that, would you, Dr. Vogel, comment on that?
I think the science on heart rate variability is pretty early days, and it's very individualized. So we would need to really, part of the goal of this is to get used to, or to start to understand what are individual variations in heart rate variability, and what sort of thresholds could we help you set as an individual. But at this point, there's not broad range guidance. There is some nice guidance from the Workwell Foundation about heart rate monitoring. And your sort of your way to calculate your personal heart rate that you might want to stay under for a threshold. I've heard variable reports of how that works, but that's another thing that certainly folks can try out.
And we have more question about wearables. I think Dr. Vogel has mentioned that as long as your device can connect with Apple Health and the Google Fit system, then the study is equipped to track those data.
Right.
Yeah.
I think maybe I haven't been clear about, there's the self-provided route and the study-provided route. So if you already have your own wearable to provide, that's where it can go through Apple Health and Google Fit, any of the different wearables you can share data from and report your symptoms that way. For the study-provided wearable, we're only providing Garmin devices. And so then, the sensors within them will be the same. It'll be, they all have the body battery feature. And so that's a little bit of a separate analysis from the self-provided. Hopefully that clears it up.
Thank you. And going back to the question about heart rate variability, I think Dr. Vogel actually shared the resource from the foundation, which I'm sharing the link in the chat to everyone from the Workwell Foundation. Dr. Vogel, is that a correct resource you're referring on the webinar to?
Let me bring it up and make sure. Yes, perfect. That looks great.
All right. So this is also from Dr. Vogel. So I think we are close to the end of our time. So there are a couple of questions that was pre-submitted. I would say that some of the question would have expressing the desire to identify a treatment or a scientific question that we are actually trying to explore. So joining research is one of the ways that we can, you can actually work with researchers together to solve that. So what's presented on the screen is a summary for the study. And also just to re-emphasize that if you're already a Solve Together user, you should be able to use your current account as well as your app to participate in studies. So with that, I would, Afifa, would you move along the slide? So I want to mention that there's some potential confusion between Solve Together and this long COVID studies. I want to re-emphasize again is that As Solve Together, we were collecting data for a very long term, and we're also trying to connect our users to various clinical studies. So therefore, if you are part of Solve Together, we'll have a team behind this to keep on connecting you to find the right study that fits your condition and your schedule and your location, etc. But the key thing and benefit for joining the Scripps study that's led by Dr. Vogel is that you have a team that would be doing a very focused analysis and to really extract insight on a cohort. So that's why, because we use the same platform, that's why we're so excited to work with the Scripps Research team here. So Afifa, would you mind move the slide deck further? And just as a heads up, that we have another webinar that's upcoming. It's about comparing immunological signature between long COVID and ME/CFS. And we also want to share that I think we really appreciate your support, and we're as a nonprofit is here to support your health and your progress. And so we would want to mention that your support is critical for us to be here and to continue supporting the whole field of research for the next big breakthrough, and to also provide you with all the research program that we can collaborate with and to bring to our audience. So if you have the capability and you're willing, we'll appreciate your support and gift. And so projected on the screen is a QR code. So if you feel that you have a heart for this, please consider scanning what's projected there. We have 2 minutes left, so I want to leave the time for Dr. Vogel for your final remark before we move on to the closure.
Wow, I'm honored. So thank you all for coming and for your great questions. It was a really fun discussion, and we are really appreciative of anyone that is willing to share their data, as well as share the opportunity to join, in particular, as I mentioned, with those that would not be able to purchase the device themselves. If they are, in one of the groups that we mentioned that's more affected by long COVID, that's even better. But we are just really looking to get the word out right now and to enroll as quickly as we can so that then we can get the results and share them with the community as a whole. So thank you all for your attention and your great questions.
Thank you. And Afifa, would you advance to the final 2 slides? So Solve organized online community. Please consider joining us. And we would also have upcoming webinar. You can find other resources, including webinar, newsletters here. And you can also join Solve Together, and we'll be here to support you for the long term and to help you track your activity level and learn pacing. And one thing about giving away the wearable, I do want to mention as a final note. I think we both share the passion with Dr. Vogel's team that we want to support people who don't have the resources in terms of having a wearable already. And then if you know anyone who is experiencing similar conditions but do not yet know about those resources, we appreciate if you can spread the words to them. So with that, thank you very much again for joining us, and we look forward to seeing you again in our future events. Thank you. Thank you, Dr. Vogel. Appreciate your participation.
Thanks for having me.